Welcome to Channel 17, the Town of Colonie Government Channel.
Good afternoon, and thank you for joining me today on this lovely fall day. Today we are very pleased to have Albany County Executive Michael Breslin with us today. And our topic today is choices in long-term care. And we're pleased to be able to give the residents of Colonie this open dialogue time with Albany County Executive Mike Breslin to talk about this very important issues, the important things that need to be addressed, and the concerns of all of the residents in the county around this issue. So Michael, thank you very much for joining us today, and I look forward to a very lively dialogue. Thank you.
Thank you very much, Chris. We will be circulating a piece of paper here, and if you would sign up, we can make sure that if there's any change to our long-term care plan that is on our website, that we can email to let you know what those changes are. I'm Mike Breslin. I've been the county executive for almost 15 years now. I came in on 2 weeks' notice on January 1st, 1995. And during the course of my time, we've looked at a number of issues that really needed dramatic change. And one of the ones that is really now most ripe for us for a number of reasons is long-term care. First of all, long-term care. That is the care required to be given for those people who have some sort of chronic condition, either because of age or disability, but ultimately yielding a disability that requires such long-term care. And the long-term care consists of just those supports and assists needed to perform normal daily living functions, as well as medical assistance and treatment and therapy and the like. It goes across the full spectrum. And if we're not careful, we think of long-term care as having to be either in a hospital or nursing home. In fact, the vast majority, it's estimated somewhere between 75 and 80% of long-term care is performed on an informal basis by family members, by children, by spouses, and by, in a more limited way, people in the community. But at some point, sometimes you need more than just that informal, or the informal actually needs assistance. And Albany County has been in the long-term care business for many, many decades, and essentially the role has been to operate what became two nursing facilities out in the vicinity of the airport, the Ann Lee Home that was built in the 1930s, and the Albany County Nursing Home that was built in the early 1970s. The Ann Lee Home closed several years ago, and it closed for a number of reasons. One, that it was truly not suited to be a nursing home. Actually, the bathing for each floor was at the end of a long hallway, and people who were in a nursing home were then forced to walk hallways to get to the bathing facilities. Among the shortcomings of it, the Albany County Nursing Home is now generally at the end of its useful life, and we've already explored whether it could be refurbished in any way, and it really doesn't lend itself to refurbishment the way nursing facilities are now operating. And the question becomes whether or not, among other things, whether or not we build a new nursing home. Now, over the course of the last 3 or 4 years, I have been going about to groups like this, as well as neighborhood groups and Rotary and other groups like that, and always, at least 50% of my presentation talks about long-term care. And one of the questions I ask, first of all, how many of you are just waiting for the day anxiously that you can get into a nursing home? And I never see any hands, and understandably, because whatever we can do to make that situation that would otherwise require a nursing home either not happen or delay, we want to make sure that we do that. We have, over the course of the last several years, dramatically increased those things we routinely have done to assist people who have the onset of disabilities and need assistance with daily living, particularly nutrition, through congregate meals and Meals on Wheels, through senior programs operating throughout the county. We have dramatically increased our support for them so that more meals are available to more people. There's another program called Expanded In-Home Care for the Elderly. ISIP is a short acronym that we use for it. The Expanded In-Home Care for the for the elderly is a program that really is not intended to deliver medical services as much as to help with normal daily living activities. Nutrition, cooking, cleaning, bathing, toileting, things like that, that make it so people who would otherwise be unable to stay in their home are able to do so. We have dramatically increased our support so that what used to be a waiting list is now gone, and all the people who actually apply for it are picked up immediately as they need it. We created a long-term care council of some 35 people from throughout the county who represent nursing homes, hospitals, senior groups, retirees, advocates for the people with disabilities, all kinds of experts and all kinds of consumers as well as their advocates, to meet to at first determine what are the resources that exist in our community and what are the needs of those people and how do we match them and how can we better. Thanks, Chris. How can we better meet those needs? And after their first determinations of what was there and what was needed, the first recommendation that was made is that we need to have a transitional team so that when an individual, particularly an individual who is precipitously struck with a need for long-term care, occasioned normally by a fall or some sort of illness that requires immediate hospitalization for some sort of a surgical procedure or treatment of a disease. That person, particularly if they don't have a family or other connections in the community, is on a very short, quick route to a nursing home, but for the intervention of people who will, as the person enters the hospital, start planning for that discharge, for the rehab, so the person can get back to where they were before they went in the hospital. We found all too often that people who were struck by a broken hip or some sort of stroke go into the hospital without the proper planning. When the surgical intervention and the skilled hospital intervention is over, the hospital needs to move that person on to another place, and if there's no other place that's immediately available or no provisions are being made, have been made, the person will be put into a nursing home, and then the thought process begins. And if you're not careful, all of the roots and the support back in the community evaporates, so the person never gets out of a nursing home. That very program is in front of our legislature starting this week. We have already gone through an RFP process. We've selected a provider, and we hope to have them online in a matter of weeks, so that we will have an ability to, at the onset, when people have this predicament, either caused by some sort of a broken bone or illness, to start that planning process. We have also supported adult health daycare. Adult health daycare is the provision of daycare in a way very similar to daycare for children, except it's provided all day long, and it is provided in a way that people get therapy, they get medical checkups, they get 2 meals a day generally, and they get social and recreational activities, so that the informal caregivers who are able to stay with their beloved, be it a parent or a brother or sister or spouse, but need to go to work during the daytime, are able to do so and know that the person is in an adult a daycare situation. Now, all of that said, there are still a number of people who go into nursing homes because there are insufficient resources in our community to prevent those people with no dollars and cents resources and without a supportive family from going into a nursing home. And you can go into virtually any nursing home and you will see a certain number of people, 15 to 20 and sometimes beyond 20% of people who really don't have to be in a nursing home, really, if they had the adequate resources, could be either outside in their own home or in an assisted living environment. Assisted living is, I like to call it in a shorthand way, assisted living is where people go into a congregate facility to live, and it's a social setting with medical backup. A nursing home is a medical facility to provide medical and therapeutic help with social activities thrown in. And anyone who is able to get into an assisted living will almost always choose the assisted living over the nursing home. And for all of us, the assisted living obviously is dramatically less expensive. To meet that need, the state has also determined that in this state, in this region, and I know in Albany County, the number of nursing home beds and the demand for them has been going down for a number of years now. Now that's somewhat counterintuitive because we all know that as a population we're living older, we're living longer. That is true, but we're also living healthier. It was only a few short years ago that the average age of someone entering a nursing home was around 65. It's now around 85. So essentially, we are becoming more healthy quicker than we're becoming older. So that, yes, there will be a bulge probably in 15 or 20 years when the baby boomers reach their 80s, but right now, there is not that demand. And if we provide the support to keep people in the community rather than nursing homes, the demand will go down even further and more rapidly. So I started to say the state has recognized this phenomenon too, that the demand is going down, and has called for the reduction of nursing home beds in the state by some 6,000. And they are proposing to trade what are nursing home beds for assisted living program beds, which can be funded for people who are able to go into assisted living but have physical disabilities that require Medicaid. They can be funded by Medicaid. Currently, in Albany County, there is only one facility that will provide Medicaid coverage, and that's the Macaulay House on Manning Boulevard of some 48 beds. All of the other assisted living beds require cash, and you have to pay your own way. So that, you know, we're proud of, as we go through this old healthcare reform on a national level, of the notion that we supposedly don't ration medical care. Well, in my mind, we really do ration medical care. Certainly, all of those assisted living and those arrangements in our community, because unless you have the money, you are totally rationed out of it. With this new program with the state, we are proposing to turn in 100 of our beds and get assisted living program beds, and we've already been talking with a number of providers who are ready to do that. There is another program that we need to get into Albany County that will be a great assist, and it's called a program of all-inclusive care for the elderly. Program of all-inclusive care for the elderly, PACE is the short word for it, run in Schenectady County by the Eddy, and proposed by the Eddy to move it into Albany County. The PACE is a program where people who are eligible for Medicaid and are eligible to enter a nursing home but do not want to can make a contract with the Eddy and the PACE program so that the person in need of long-term care is enrolled so that they are provided for either by being picked up every day and brought to an Eddy facility where they receive medical care, nutrition, therapy, social activities, just like an adult daycare, except this is a long-term contract that because the person is eligible for a nursing home, if they actually need to go to a nursing home, they will be placed in a nursing home. But through the intervention of the loved ones in the home where the people live, and the EDI trying to provide those services and transporting them back and forth, 90% of the people enrolled in the program at any one time remain in the home and not in a nursing home. Now, towards the end, many people do go to a nursing home, but on average, that's 10% of the people enrolled. That means that in Schenectady, of the 150 enrolled, 135 are still remaining at home. And the other 10% actually are physically in skilled nursing facilities. And through the course of time, many of those others will actually get to a nursing home. But at one time, only 10% go there. That means people are being able to get their choice to live the way they want, and it's dramatically less expensive for all of us. That too can happen in Albany County. The EDI is proposing to move here. There is also a program by Senior Whole Health, another organization that's already moving to do that in Albany County. And St. Peter's and Seton is planning another one to do that. And we're encouraging them to come and giving whatever assist we can to do them. Again, I go back to that number that there's a floating group of somewhere between 15 and 20 or so % of people in nursing homes who fit into these categories, who could be in either assisted living or the PACE program, so that they wouldn't have to be in a nursing home. Again, dramatically reducing the demand for nursing home space. With those simple numbers and the demand going down, and given the fact that there are almost 1,850 nursing home beds in Albany County, and the Albany County Nursing Home is authorized for 250, over the course of the next 18 months to 2 years, I am proposing a plan to transition out of the nursing home business and into these alternatives. Now, there has been some concern about the so-called hard-to-place people. Hard to place because normally because they have dementia or Alzheimer's, for which the reimbursement rate is rather low. The state and federal reimbursement rate through Medicaid is determined based on the medical needs and difficulty of the medical problems presented by individuals in a nursing home. And generally speaking, those with dementia and Alzheimer's don't present difficult medical cases. But on the other hand, because of the difficulty in communicating with them and sometimes their conduct, the effort and expense to actually handle them is somewhat higher than the reimbursement rate. So the practical result is that many nursing homes, because of the low reimbursement rate and difficulty of handling them, do not like to take them, and they become the, quote, hard to place. Working with the state, we have proposed a plan that we're working to get implemented so that the county would be able to give an added premium, an extra reimbursement to those nursing facilities in our community who would be willing to take these otherwise hard to place. And we're convinced through that, we've talked with all the nursing homes in our community, that we'll be able to place even the so-called hard to place. And so as a consequence, in this changing environment, from the time when I was a kid, and there really weren't any nursing homes, and everyone stayed in the community, and it was a different time. Families weren't as broken up as they are today, and the situation was not such that many of the youngsters in the family, after receiving their education, move off to Arizona, Alaska, California, wherever, and aren't around. And we didn't have Medicaid back then. I'm that old. So that there was no federal and state government who would provide those resources. So people had to stay at home. It has dramatically changed, and there are so many other resources that are available. And I want to make sure that those resources go as far as possible so that we can start reaching out to the community and getting people in their homes when they need assist in simply getting nutrition, getting picked up and brought to congregate meals as the seniors here in Colonie get, and throughout our whole of the county they get. And when you can't do that, to deliver Meals on Wheels, the expanded in-home care for the elderly, to provide other assists, in bathing and toileting and in cooking and shopping and the like, so that people who don't have medical problems, but for the assistance would start encountering medical problems so that they can stay at home. And to focus on daycare and the PACE programs and all of that, so that we give people those choices that they want that will allow them to stay at home or in the community outside of a nursing home for much longer periods of time. It works. It's what people want. And finally, on the dollars and cents side, we are currently in the county subsidizing the Albany County Nursing Home by last year, $18 million. When you do the addition, that's over $80,000 a person. $80,000 a person that, if the plan that I propose works out, that whole expense goes away because those people will be taken care of in other nursing facilities. And our costs are considerably higher because of the civil service system, the pensions, and other fringe benefits that affiliated with running a municipal nursing home. Excuse me. And under the circumstances, in this year, where our total real property tax levy for the county is some $67 million, $18 million of which would be for a nursing home, and it's soon to be $20 million. I don't see how we're able to do that with all of the other things that demand the resources throughout the county. So I proposed a plan, and I'm looking forward to implementing it in a way that over the course of the next 18 months, 2 years, will fold the plan in a way that everyone will be taken care of in a reasonable way. Those people who are in our nursing home will get placed in other facilities that will more than meet their needs. So that is the plan. And if you have any questions or comments, I'd love to hear them. And I'm here as much to tell you about what we're planning to do as to hear from you as to what you think we should be doing and what questions you might have. Yes, ma'am.
The PACE program that you spoke about, is that like a daycare, or do people stay there 24 hours?
No, it is like a daycare. But it is like a daycare for those people it works. When you enter the PACE program, the individual makes an arrangement with the Eddie that we will provide, Eddie says, we will provide care for your loved one for the rest of his or her life. And we will make every effort to allow them to stay at home. We will provide the services that I described. And in the event that the person gets to the point where they need to be in a skilled nursing facility, they will be placed in one of the Eddie skilled nursing facilities. The Eddie is convinced, and the deal is made also with the government as to Medicaid payments, and the payments are based on the general statistics that are related to you, that 90% of those people generally are not in a nursing home, and only 10% go in. So the cost to us as taxpayers, whether it's state, federal, or local, is dramatically reduced. And there is an assurance that as long as they're able to put the people in the PACE program so that they actually go up and go there every day and then come home at night, they will continue to do that. But at the point where it becomes impossible, then the person goes into the nursing home and it's folded right into the whole program.
So you're not advocating eliminating nursing homes?
Absolutely not. No, no, no. In fact, the PACE program includes a nursing home element right as part of it. Yeah.
Mr. Breslin, now that nursing home, will it be located in Albany County?
That's
Eddie facility?
That's an Eddie facility, yeah.
Yeah.
The Eddie would be doing it.
All right, so that they don't have to be concerned about trying to visit that person and having to leave the county or travel?
No.
Okay, thank you.
I've had a lot to do with a number of nursing homes in Albany County, which is quite richly endowed with nursing homes, by the way.
Absolutely.
Private ones.
Yes.
Very richly endowed. And what I'm very aware of, having taken care of a number of family and close friends, their affairs, because nobody else was able to do it. And then a number of acquaintances I have had a lot of dealings with who are in Teresian House and a number of other nursing homes. But already the county and the state and federal funds that come together to pay Medicaid costs, 75% of the budgets in most of these facilities are people on Medicaid.
Oh, yeah.
So that already it's not like this nursing home here that's
Yes.
falling apart is the last resort. Or it's only for people who are, quote, poor or eligible for Medicaid. 75% of one of the best nursing homes, Teresian House, is Medicaid patients. You look at they hand out an annual report every year and are rated cover to cover. That is the fact. So that there are other options that would free up some of the public resources that Mr. Breslin's talking about to develop some of these other options, which I'm 68 and I don't want to go to a nursing home. I want to die in my garden in the back with a trowel in my hand. But if it comes to that, I would like to have a whole lot of steps that I could go through of different levels of care before I need to go into a skilled nursing facility. Just the whole continuum of care, and the Eddie is one of the best models in the United States of developing continuum of care. They just don't happen to have operated in Albany County. They've done it in in Rensselaer and Schenectady counties. I feel really enthusiastic about this.
I feel the same way, and you make a point that I should include in part of my regular one, is that everyone thinks if you have Medicaid, you go to the Albany County Nursing Home, and all the others are private pay. Couldn't be further from the truth. The vast majority in every single nursing home is Medicaid.
Just look at the pie charts. Ask them for their pie charts. You'll see that.
Yeah. Another question back there.
Yes, I'm actually in the long-term care insurance business. I'm not here to sell insurance.
Okay.
I think I heartily endorse what you're doing because people who have insurance, basically, it's interesting, 75% of claim payments from Genworth are from home care. About 18% are for assisted living. Just a small percentage are for nursing home care. So the people with means to pay, they vote with their dollars and their waters. They say, I want care at home, assisted living, nursing home only if it's absolutely medically necessary. Yep. And this will allow people who can't afford long-term care insurance. It will allow them to get the same type of benefits, consumer choice that people with means have. I think that's
Thank you for making that point. That's when he is saying that as an insurance businessman and the organizations that he works with, for whom he writes policies, generally for people who can afford to get long-term care health insurance, they dramatically use significantly more home care and assisted living. Why? Because it's so less expensive, and it's what people want. That's what they want, and they can afford it, and they will do it.
Assisted living is not only less expensive than nursing home care, but it's also a more congenial environment.
It's more fun.
Yeah.
Yes.
So it's a no-brainer.
Exactly. I like to describe it as yes, the assisted living is the social living environment that has medical assurances behind it, and the skilled nursing facility is a medical facility for which we try and put social activities as well. Yes, sir.
Well, I think that we, through Medicare, we support too many people that don't even need nursing home care, such as the one I'll name, the Little Sisters of the Poor will take. Now, they told me that all they take in is strictly people that are indigent. But I know of a scientist that's in there. And I question, would we be better if Medicaid had different rates for harder to take care of people?
They do that. They do have different rates for harder to take care of people.
Because I tried to get my wife in a number of places, and they wouldn't even talk to me unless the person was totally capable of showering, of feeding themselves, of taking care of themselves.
You mean assisted living or nursing home?
Nursing home.
Oh, wow.
And that's
And they weren't interested. They said, we get Medicaid for people that are totally able to take care of themselves. And I found that in a number of places.
I'm not aware of any. I think the comment made earlier about that we're blessed with a great range of very excellent nursing home facilities is accurate. We really are. I do know that in any given nursing home, there are people, had they the choice to make between a nursing home and assisted living, they would choose assisted living and it would work for them. I also know that the pressure of a nursing home, no matter what the nursing home, is if it's not full, it doesn't work most efficiently. So, and then if you can get people in for whom you can get Medicaid money, you can treat them and they can take care of themselves, but they have some technical ability to be there, those people will get there. But I don't think there's any nursing homes that turn people away simply because they can't bathe or something like that. Because in fact...
I didn't say they can't pay.
No, they can't bathe.
Oh, bathe.
And perform, because in fact, it's sort of the reverse. When people are in assisted living, they're able to stay there as long as they can pay and as long as they can perform normal daily living activities. And when they cannot perform the normal daily living activities, that's when they become ineligible to stay in an assisted living facility.
But I think that we've had the county home for a number of years. I can't say exactly how many, but it wasn't taken care of.
That's correct.
And that's the reason now that it needs so much.
Well, it isn't so much it's not taken care of as
It wasn't, I said, taken care of.
Even if it were taken care of, the Anley home that had a row of rooms down long corridors, one after the other, with the bathing facilities at the end of a hallway, was intended more for assisted living and a poorhouse than it was as a nursing home. And that's why we closed that several years ago.
That's close.
When you look at the Albany County nursing home, it has more the look of a hospital than it does a nursing home in the way that it's laid out. Yes, we've changed it dramatically to have pods and areas where people can gather and congregate, but the hallways where they live looks more like a hospital than it does a nursing home. That's not how nursing homes are built today. That's not how nursing homes people want them to look. And if to continue to operate it like it is, it's not nearly as attractive as the nursing homes that are being built today. Not because it's not been maintained as much as because that's the way it's laid out. They're laying them out much different today.
Should be ashamed if they don't have a place for the people that require this service. And I think we need the facility. And I think
that place with Alzheimer's. He's been there.
I can't hear you, ma'am.
My husband is in Albany County Nursing Home.
Yes, ma'am.
Alzheimer's. He's been there about 5 years, and he threatened and tried to kill me. So there was no way I could take him home, even for an hour now. When you start off your speech, you say, is anybody anxious to go to a nursing home? Is anybody anxious to be ill when you get old? Is anybody anxious to live to be 90 years old? I'll be 85 next month. I'm not crazy about being 85 because I have a lot of physical problems of my own. That's another reason why even if he didn't have Alzheimer's, I'd have difficulty trying to take care of him. But when you mention, well, we can manage better by just having nurses come in. Okay, do those agencies send people on holidays, weekends, 24 hours a day? Very, very seldomly, you get a nurse to come in and give your patient a bath or check his meds 1 or 2 hours a day, maybe twice a week. There is no way that I know of any people, unless you're maybe a millionaire and you can afford $25, $30 an hour for somebody to give it 24 hours a day. I was a nurse, I had 7 children, and my husband worked very hard to take care of us. And I didn't even work when they were very young, but then I worked later. But there is no way I could possibly save up to millions of dollars to take care of us when we got old. And my children, unfortunately, as you say, do not live around here. They're Virginia, North Carolina, Michigan, all over. That's where they went for their jobs. And none of them have a lot of money either. So I don't see how you can possibly say, and I wonder if you ever went through the nursing home and said, oh, this person doesn't belong here, this person could stay home, this one just needs someone to give them a bath twice a week. Did you do that, or did you say, oh my God, that guy has no arms, that guy has no legs, that guy has dementia, that's Alzheimer's. All of these people need their care, or 98% of them do. So I think you're barking up the wrong tree or something when you say, let's get rid of the nursing homes for most people. I know you're not saying get rid of it completely, but you're saying most of these people don't need nursing homes. In a few years, I may need a nursing home because of a lot of physical problems. Are you going to tell me I don't belong there? That if a nurse comes in and gives me a bath and feeds me once a week, that's all I need? Am I going to be toddling around my house at 90 years of age, maybe with a fire or some kind of a break-in or a fall? That's ridiculous. You're not thinking like an older person. You're thinking like somebody who's 50 years old, maybe. And then also these younger people that are coming along, there are a lot of them. And don't forget, that was the generation that used a lot of drugs and a lot of alcohol, and they smoked. They're not going to be in great shape when they get to be 75, 80 years old. They're going to need care. I'm sorry, take what you're telling me, but I'm very, very upset about this whole situation.
You're not taking up my time. I have met with you, the Family Council, numerous times privately, numerous times publicly, and I've heard what they both have said before. And a couple of things I would like to respond. When I have heard the arguments, and I lament the difficulties that you've had, but among the things that my plan would provide would be assistance for individuals who are at home providing care to their loved ones before they get them to a nursing home, before they need to have a nursing home. And contrary to what you said, that I said most people in nursing homes don't need it. I never said that, and nor did I ever say that we don't need nursing homes. What I said was that we can provide better assistance to those people who need care for their chronic condition so that people can remain in their homes, remain in assisted living, remain outside of a nursing home much longer, and in some instances might never have to go there. I know that we need to assist caregivers, and that's part of what I'm trying to implement. I know that when first I met with the Family Council, they told me how terrible it was. For many, many years they struggled, and what we're trying to do is to ease that struggle before and while people are in nursing homes. We want to put assist out in the community. We want to arm all of those community groups. We want to have cataloged all of the various facilities so people will know where to turn and that they will be assisted. And I don't know how more clearly to say it. I recognize that there are some people, and I know that one of you recited the difficulty in moving people out of the Anley home. There was no question that the Anley home really had limited facilities to be a nursing home because of the way it was constructed in the 1930s. And I know how traumatic it was for people just to move from that building across the street into the Albany County Nursing Home. But given the facility and the limitations of it, and given we only had so many people to run two buildings instead of one they wouldn't have fit in the Anley home. The Anley home was dramatically less appointed to be a nursing home than was the Albany County Nursing Home. We had no choice. Did it present a difficulty for people having to move? Yes. Will it present a difficulty for people being transitioned out of the Albany County Nursing Home? I know that it will, and I don't question that. But I don't think that that we can, nor can I, demean all of the other nursing homes that are in our community who provide wonderful service to a whole broad range of individuals who need skilled nursing facilities, who accept Medicaid patients, accept people with dementia, accept individuals with Alzheimer's, and we are convinced that through more collaboration with them, they will take dramatically more. Now, do I have any other questions?
Yes, I have another question. I'm sorry to take up your time, but perhaps it's a rumor, but I have heard that several times people have tried to move people out of Albany County Nursing Home to other facilities and were refused. They did not want to take those particular people, especially Alzheimer's. And also,
I am not aware of any. Oh, I'm sorry.
Also, that has happened in the past, where some people were not passed on to another nursing home locally, but sent to Massachusetts and Vermont. Now, is that correct for people? Is that a correct statement, that people have been sent to Massachusetts, Vermont, and
I am not aware of anyone who was at Albany County Nursing Home that was shipped to Massachusetts or Vermont.
All right, then maybe that's just a rumor. And I've also heard that it costs more to send them to another state. They want more for that.
And yes, sir.
There may be, for example, in any nursing home, there may be a resident who requires certain medical interventions that can only be given in very specialized places. For example, if you need a great deal of respiratory care, as I understand it, the only place in eastern New York State is a place down in Columbia County.
Kingston.
That's correct.
It's in Kingston.
That is correct.
My long-term care insurance is not with your company.
No, it's in Kingston. And
That's
there's one
but
in
that's the only
Massachusetts.
place that has the respiratory.
Pardon me? Yes, and there are some people with traumatic brain injuries for which there's no place locally at all. It would be impossible by almost any standard for Albany County or any other municipality to create a facility that would take absolutely everyone. What I'm trying to say is that given the system that exists today, which has so many fewer resources out in the community to assist people where they want the assistance so they can stay there longer, and have alternatives to being required to go to a nursing home before they actually need to, I think that we will all be better served by the plan that I presented. I want to thank you all for coming, and thank you for your questions and interest.
And thanks.
Welcome to Channel 17, the Town of Colonie Government Channel.